A young girl, barely 11 and rather bored, hangs around while her mother receives counselling at a newly opened mental health centre. But it's not the mother who needs help, it's her troubled daughter, who's been fighting, showing antisocial behaviour, and who disappears frequently from home. One small addition to ever-increasing numbers of Afghans carrying big psychological burdens.
خانم خدیجه گفتگی اینجا که خانه رفتی همون کسایی که میزنه جلوگیری که نزنه مشتکایی که دیانه میگه جلوگیری که امیر دیانه نگه خودت میگذره تشویق که مگه میگذره خوب ترش اگه میگذره چیتر بیادی.
Mental health experts say many more such cases remain locked up inside the family unit.
I think the war is connecting the mental health, mental problem for the children, and also family problem. Also, the father and mother not respect the children.
Among the problems that Afghans face, dealing with mental health isn't a high priority. But many, among them the European Union and its Afghan partners, argue it should be, not least to help people deal with the fallout of exposure to conflict, an increase in domestic violence, fragile security, economic desperation. In Bamiyan, in central Afghanistan, the EU has launched a programme which begins to help. This dedicated counselling centre is the first of its kind here. Experts go out and about to inform potential patients of their services. They're fighting against a conservative private culture here, but experts say the consequences of not dealing with mental health openly could be serious.
Can easily affect the future of the country, even the peace-building process, because of having a lot of violence inside the country.
The key breakthrough has been to get provision for mental health included in the basic health services now offered to Afghans. Building a health system in Afghanistan from practically nothing has been a beacon of achievement in the past 10 years. As one of 3 international actors financing the healthcare rollout, the EU has been instrumental in pushing services to the country's furthest corners. Daikundi is the poorest of 34 provinces, yet it's a model of progress for healthcare provision in Afghanistan. Its remoteness, its lack of skilled personnel and lack of resources offer an insight into the enormous challenges that health managers face and into the advances being made, particularly in bringing down mother and child mortality. One grateful beneficiary is Shefiona, 8 months pregnant, who spent 4 hours getting from her village to the new hospital in the capital when she needed urgent help.
وضعیت خیلی خوب شده خیلی بدم بود و وضعیت وقتای در روزی حالتی بودم که نون شب که می‌خوردم از این سر با اون سر گریه می‌زدم میگشتم تا خواب این در حال مگیج بود دیگه آخر دم تنگ شدم زن همسایه آمد گفت که ببری رو شفاخانه.
Most Afghans live in rural areas and can't get to hospital, and so a network of community health workers, male and female, has been set up to bring them access to some form of basic health care. When the Taliban were removed from power, just 6% of the population had such access. Now it's 66%.
بعضی از خانم‌ها زیاد درباره مزی حاملگی آگاهی نداشت با اون صورت. حالا اینا رو اگر مثلا خیلی تشویق کنی باید شفاخانه بره. راجع به برای واکسن اینا برای طفلکایشی برای خودشان که مثلا واکسن‌های مفیدی است که واقعا جان طفل شره و دان خودش را مثلا تا بعد از سالم نگاه مونه.
But these services, like all others, need security to thrive, and conditions in most parts of the country are getting worse, not better. The EU recognises the link between strong security and the advances in development which Afghans yearn for. Meanwhile, Afghans scratch a living as best they can. For many, it's a daily hustle for survival here, but it's not without hope.
This country has seen already a lot of sadness, of loss. Only now we have really the possibility, we have the chance to make a difference, because all the building blocks, all the elements are there. And so you just need to put them together.